Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent plantar fasciitis yourself. Sit on the edge of a chair, place the painful region of your heel, arch, or forefoot onto the edge of an upright soup can, point your toes up, put your hands on your knee and lean forward. Hold for 10 seconds, then move to the side onto another painful spot. Repeat the procedure 15 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. This is the plantar fascia. If it hurts yet feels good at the same time, you're doing the right thing. It's so easy, your body weight does all the work for you. If the pain persists, add the following technique. Cross the affected foot on your knee and point your toes up. Using both hands, firmly press the edge of a small can just above the pain in your heel, arch, or forefoot, then slowly slide it downwards across it. Repeat the procedure 20 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If you have less pain when getting out of bed in the morning, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 1 to 3 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. If you're on bare skin, you may want to change the sharp edge of the can for the round edge of a spice bottle and add several drops of hand cream. Never apply heat, including hot baths, since heat increases inflammation. If you've just hurt yourself, you may apply ice for 15 minutes 4 times a day for 3 days in order to reduce the inflammation. In order to accelerate healing, avoid high-heeled shoes and shoes with hard heels and soles. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of plantar fasciitis, if you heal yourself using my method, it's scientific proof that your plantar fasciitis was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, heel spur, flat arch, bursitis, torn tendons or muscles, osteoporosis, misaligned vertebrae, subluxations, pinched nerves, a short leg, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of plantar fasciitis is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now, and happy healing.